The back pain and the disc prolapse back pain, these are the two different variants, are related to one area, should be ruled out. What does it cause and how does it experience? The back pain, simple back pain, we call it as a lumbago, or the spasm of the muscles due to sudden stress and strain or any injuries, does cause the spasm of the muscles in the back, which lies both sides of your spinal vertebral bodies. So that is ruled out from the history and as well as the basic x-rays and the clinical examination. If there is no neurological problems and there is a localized pain and the x-ray reveals that there is a straightening of the spinal cord, is evidence that there is a possibility of lumbago or the stress and strain of the paraspinal muscles. That is called a low back pain. So the disc prolapse is the different disease where the disc in between two vertebral bodies, which acts like a shock absorber, is like a annular ring, and inside there is a jelly like shock absorber is having fluid inside, and around that there is a oil seal. When oil seal is burst out, then the oil leaks out of the shock absorber. Same way in the disc also, when then there is a injury to the annular ligament, then when it is burst open the annular ligament, there is a jelly like fluid comes out of the annular ligament, and it protrudes out and it prolapses out, and then it puts the pressure on the spinal cord or its nerve roots. So obviously when the disc prolapse nerve root is pressed or the spinal cord is pressed, so it shows the different symptoms from the simple low back pain. The simple low back pain will have a localized pain, but the disc prolapse pain will have a radiating pain where there is a compression on the cord or a compression on the root. So exclusively when there is a compression on the right or left side of the roots, according to that, that side of the limb will be radiating pain. So obviously there will be sometimes a neurological weakness like power in the lower limbs will be reduced whichever the nerve is affected, and there is this loss of sensory, and there is loss of reflex test, and then there is a weakness in that limb. So in that case, even sometimes there is uncontrolled bowel and bladder habits. So once the disc prolapse causes the root or cord compression, leads to certain neurological problems which to be ruled out. So whether it's a simple low back pain or whether it's a the prolapse of the disc pain should be ruled out with a CT scan, MRI, which clearly tells you the what type of pain it is, whether it's in a disc prolapse or either it's because of the spasm of the paraspinal muscles. So this is the way we should rule out the low back pain and treat accordingly. The simple low back pain can be treated with the painkillers, bed rest, and local ointments and liniments, and then a little physiotherapy really helps you to relieve with the anti-inflammatory medicines. But when there is a disc prolapse, we must rule out the amount of disc prolapse and then the amount of neurological deficit. According to that, we should advise whether to do with the conservative treatment like back belt and painkillers, and the nerve related pain can be controlled with the certain medicines that way, and the bed rest and certain times traction to the pelvis to relieve the disc problem or relieve the spasm. So the disc prolapse which is severe enough to that the pain is continuous for more than 6 months even after the failure of all the conservative treatment, and if there is a severe neurological deficit, weakness in the limbs, then it's an indication for a disc surgery so that patient can be relieved of pain and the neurological problems. So this is the way we should treat pain localized or pain due to disc prolapse.